Hi, my name is Maria Seha, and today we'll be starting off with the A&P forearm. So I'm going to have my person right there. Here's my, you can see, A&P. This is the right arm, therefore I will use the right marker, and the cassette size is 14 by 17, 40 inches SID. There is no breathing instructions. The central ray is directed perpendicular to the midpoint of the field. We're trying to get the projection, the AP projection of the radius, ulna, and distal humerus, and or proximal row of the carpal bones. So the next one we will do is lateral forearm. So patients kind of just similar in the same position, sideways, like this, straight, okay. Right there. Okay. Again, this is just 40 inches SID, 14 by 17. The elbow is flex at 90, and then a line through the humeral epicondyles is perpendicular to the film plane. Central ray is directed perpendicular to the midpoint of the film space. A lateral projection of the radius, ulna, distal humerus, and our row of the proximal row of the carpal bones. So those are the two for the forearm, A&P and lateral. And then next, we will do the A&P elbow. And for the last one again, this is the right arm. So right marker. So our next one again is going to be A&P elbow. So I'm going to bring this a bit more up, such as so. And the film size is going to be 10 by 12, but still at the 40 SID. And the hand is supinated. And I am trying to get the central ray is directed perpendicular to the elbow joint. The anatomy that I'm trying to get is the elbow joint of the A&P, distal end of the humerus, proximal end of the radius, and ulna. So then for the next is the medial oblique. So this one, the patient will have their arm extended as such, and then pronate. So I'm showing for what's pronated. Kind of hard because it's a flat surface right here, but they would pronate their hand. The central ray of the elbow will go through the middle of the elbow, and this is at a 45 degree. There it goes. And the central ray is directed perpendicular to the center of the elbow joint through the center of the film space. And the anatomy we are trying to see is the oblique projection of the elbow joint, distal humerus, and the proximal forearm. Coronoid process of the ulna as well is demonstrated. And I threw this in there again because it's the right arm. So for lateral oblique, the again, patient position is extended elbow to the center of the field, which it is. And they will externally rotate the hand so that the line, the humeral epicondyles, is as a 45. So, let's see. Okay. There we go. Yeah, you can just stay still. And the central ray is directed perpendicular to the midpoint of the elbow joint through the center of the field. And we're just trying to get the neck of the tuberosity demonstrated clear without superimposition of the ulna. This is again 10 by 12, 40 SID for both. Never had to move my right marker because we are using her right arm this time again. And the lateral elbow, I will have the patient flex to a 90 degree, keeping my right marker right there, 10 by 12, 40 SID. And central ray is directed perpendicular to the midpoint of the elbow joint through the center of the film space. And what we're looking for is the distal humerus, proximal forearm, and an lectin arm process, as well as the fat pads should be demonstrated. And let's see, for special views, we will do the Jones. So the patient will flex their elbow, placing it on their shoulder there, and we would push you a little bit more up this way. There you go. Supposed to be about 2 inches. Go a little bit more. It's kind of hard because this is right here. But yes, so I'm just trying to get 2 inches superior to the lectin arm process. And what I am looking for is forearm and humerus should be superimposed with no rotation. And the lectin arm process is the soft tissue, and distal humerus should be visualized. This is again 10 by 12 film, 40 inches SID. And then for the other one, patient, well, we're gonna stop here and pick up the next one, the second special view of the AMP flexion on the next video.